Thank you. Ministers, Dr. Foley. Good evening, everyone. Okay, we'll start off with our vision in Western Sydney. I always think vision's a little bit Scott Adams, but there you are. We certainly do service areas beyond our local health district, and indeed from the district of Goulburn we've just picked up another 200 EMT cases. Sorry about that. We certainly do operate beyond and take patients from beyond our district, and we've just inherited 200 more EMT cases from the Goulburn district. We've got a large population that occupies a large geographical area. This large population includes an incredibly diverse group of ethnic people. It's a pretty depressed socio-economic area in many respects, and that of course adds to the morbidity of our patients and increases our patient load. Our 8,000 staff look after about 50,000 emergency cases each year, 50,000 admissions, and over 35,000 operations, and it's the latter that I really wanted to focus on in terms of innovation in our local health district. As was mentioned, I'm the Executive Medical Director of Auburn Hospital, and we have a high-volume short-stay surgery unit at this hospital. The innovation's based on the directions of the Surgical Services Task Force, of which I'm a member, and it involves a defined set of high-volume surgical procedures that fit into a length of stay not more than 3 days, and involves and revolves around evidence-based clinical care pathways. We wrote these clinical care pathways at Auburn some 12 years ago, and they're continually being refined. We have improved the patient experience through a very tried and tested reliable admission and discharge system. We make sure that patients' expectations are clearly defined prior to them coming into hospital, so they know exactly what's going to happen, when it's going to happen, and what to do when they go home if something goes amiss. Good planning improves our access and service efficiency in both the operating theatre and bed utilisation. Now at Auburn, we have a proven track record in high-volume short-stay surgery. Indeed, we did the original work on this at Auburn in 2001. We have a multidisciplinary clinical care system of pathways, and again, as I mentioned, based on evidence. A high proportion of our patients need a day-only and extended day-only surgery. In fact, it's very good to see the role delineation really starting to bite in our health district, where hospitals do what they do best. This covers designated procedures in general surgery, ENT, gynae, plastic and vascular surgery. I'm sorry, I wasn't looking, I was talking, and I've lost one of my slides there. Okay, so earlier on this year, the New South Wales Department of Health gave us, now the Ministry of Health, an enhancement grant of $850,000 to do a high-volume short-stay surgery program. We've done 413 additional cases in 2011-12. More importantly, the day-only and extended day-only cases amount to 96.5% of the throughput. Now, where are we going from here, I guess is the question, because in reality we can do this standing on our ear because it's what we do and we do it well. The question is, can we do better? And the answer is yes, we can. If we have the tools and the resources and we implement the scheme that I started in 2001, we demonstrably and provably can do twice the number of cases in a given amount of time, 25% cheaper. And with activity-based funding coming in, that's very, very important. The second thing, or the second area we'd like to go, is in contracting services. Now, I'm not talking about contracting services to the private sector. I'm talking about contracting services into the public health sector from within our district. And of course, role delineation and pooling of patients will allow that to happen. Thank you.